So good afternoon, everyone. My name's Allison. I'm a registered health promotion practitioner and mental health pharmacist. And I'm currently working towards a PhD with Professor Steve Hake, Dr. Helen Quirk and Dr. Alice Bullis. So I'm going to talk a little bit about community-based initiatives and how parkrun may fit into this model. So community-based initiatives are sometimes called community-centered activities, community-based interventions, or any combination of these words. There doesn't seem to be a defined definition. They're often used as a health promotion intervention for people at risk of social isolation and poor mental well-being. And some groups, such as middle-aged men, people from minority ethnic groups, older people, and those living in areas of deprivation, may be particularly helped by this type of initiative. Some examples are seen here in the photos. Community gardens and allotments attract people of all ages and genders, whereas community choirs tend to be mainly female. Some groups are focused on one particular gender, such as men's sheds. They began in Australia and are becoming very popular in the UK and Ireland. Some activities are for specific ethnic groups to try and encourage participation. And the final photo here is from a walking group called Boots and Beards for Asian people living in Glasgow. Although these groups initially look very different, they all have lots of things in common. They're organised by local volunteers and they may have a skilled coordinator. They're very accessible. They're either free to access or very low cost. They're based among the community rather than being a long distance from where people live. And although they're based around an activity, the main focus is on social interaction. So I mentioned that community-based initiatives are sometimes used to improve the mental well-being of people in a community. But what do we mean by mental well-being? Well, mental well-being is sometimes described as positive mental health. It's more than simply a lack of a mental illness, and it has been described as a resource for everyday life by the World Health Organization. Someone with good mental well-being can be described as flourishing, enjoying life to the full, happy and satisfied with life. Educational performance, productivity at work, and successful relationships are all supported by good mental well-being. Short periods of poor mental well-being are normal, especially in response to situations like the current COVID-19 pandemic. However, prolonged periods of poor mental well-being can lead to poor quality of life, low productivity, and may eventually lead to a physical or mental illness if not addressed. We measure mental well-being using several different scales. Some examples are the mental health continuum, which looks at the emotional, psychological, and social elements of well-being, or the short World Health Organization Wellbeing Index, the WHO-5, which is a quick and easy measure with 5 questions that have been translated into over 30 languages. But the scale that's very popular for population level measurement of mental well-being is the Warwick-Edinburgh Mental Wellbeing Scale. It's a 14-item scale, which also has a short version called the Short Warwick-Edinburgh Mental Wellbeing Scale. Some example questions from the scale are things like, I've been feeling optimistic about the future, I've been feeling useful, and I've been feeling interested in other people. So you can see the questions are all very positive focused. The respondents score each question on a scale of 1 to 5, and the results are added up to give an overall mental wellbeing score. So where does parkrun fit into all of this? Many of you will be very familiar with parkrun. It's a free running and walking event which takes place all across the UK and in 22 countries worldwide. It's currently on pause with the COVID pandemic, but is due to return to England in June. The events are weekly, they occur all year, and people can join at any time. You can attend as often or as little as you wish. Now, parkrun is many things to many people. It might be a timed run with rivals from an athletics club, a chance to meet friends for a walk and chat, a motivation to get out of the house to be a marshal and have a coffee afterwards. So to understand more about how parkrun may impact mental well-being, I'm going to consider it as a community-based initiative, rather than just a physical activity on its own. This fits with the World Health Organization's Global Action Plan, which names parkrun as an example of a free, universally accessible, whole of community event. So to further understand how parkrun is similar to these community-based initiatives, I designed this graphic to look at the different elements of parkrun. So as you can see, it is a physical activity, but it also is a social event. It takes place in a natural setting, and it attracts a wide range of ages from age 4 upwards. So as I progress with my research, this diagram may change and probably will evolve. So there has already been some research into the mental and physical effects of parkrun. I'm just going to quickly overview the research relating to mental well-being. One study showed that parkrun frequency was associated with high mental well-being. So the more parkruns you went to, the more likely you were to have a high mental well-being score. People who were non-runners before they started parkrun were more likely to have higher scores for mental well-being than people who were already regular runners. Some studies used a scale called the perceived stress scale to measure the stress levels before and after parkrun participation. They found that stress scores reduced immediately after participation on the same day, and they also reduced after 6 months and 1 year after parkrun registration. And finally, Grinsight's team investigated the personal well-being benefits of parkrun in Australia. They found some gender differences, and they particularly found that men tended to experience well-being related to community connectedness. Now, all of these scores and results don't really prove that parkrun can cause good mental well-being, but they definitely indicate that there are some positive effects. So there's been very little research so far looking at how and why parkrun may promote the mental well-being of different population groups. And there has been very little focus on individual groups such as older people, middle-aged men, people from different ethnic minorities, and people from deprived communities. So to fill this gap, in 2018, Sheffield Hallam University were commissioned by parkrun to design and analyse the results of an ambitious survey to measure the health and well-being of the parkrun population of the UK and Ireland. The survey resulted in over 60,000 completed surveys. There were 11 million answers to 47 questions. There were included in the 47 were questions about mental well-being, which included the short Warwick-Edinburgh Mental Wellbeing Scale, happiness scales, and life satisfaction measures. The respondents were separated into runners, walkers, and volunteers, and also segmented by gender, age, ethnicity, index of multiple deprivation, and activity level at registration. So my role in the data analysis has been to look at any results that are relating to mental well-being. I initially focused on the short Warwick-Edinburgh Mental Wellbeing Scale results. And what I did was I took the results from the parkrun survey relating to England and compared them with the population statistics for England. I couldn't compare the whole of the UK because there are different results for different areas of the UK, so I had to focus on just one country to start with. So as you can see from this graph, the bottom line with the yellow is the results from the whole population of England. So as people get older, their mental well-being doesn't really change that much. There's a slight increase in mental well-being around retirement age, but generally the well-being is fairly stable. The upper lines are for the parkrun population. So for the younger people, there is a similar mental well-being between parkrunners and the whole population of England. But from around the age of 35, we start to see a statistically significant difference in the mental well-being scores. And by the age of 45, we're seeing a clinical significant difference in these mental wellbeing scores. Now, we can't say from these results that parkrun participation has caused these changes because there's so many different factors that could be involved. But there's definitely something happening here, which I'm going to explore further in my research. In a similar way to the age group data, I compared the results for people in England living in different areas of deprivation across the country. The parkrun results followed a similar pattern to the population data. So those living in the areas of highest deprivation, unsurprisingly, had the lowest mental wellbeing scores. However, there was a significant difference with park runners reporting higher mental wellbeing scores throughout. Now, this could be to do with the way that the data was collected between the different populations, or there could be something else going on, which again, I will explore throughout my project. I also looked at different ethnic groups and pre-park run exercise status, but there was very little difference between the results in those groups. So as part of the survey, the parkrun participants were asked if there was anything else they would like to say about the impact of parkrun on their health and well-being. And they replied in their thousands. So the next step in my data analysis is to do a content analysis and a thematic analysis of the comments relating to mental well-being. So this should give more insight into how and why parkrunners are reporting high mental well-being scores, especially in middle age and upwards. So I've chosen a couple of the comments just to give you an idea of what people have said. So one of the best things about parkrun is that I now have friends across the whole age range, said a man aged 74. Thanks to parkrun, I speak to members of my community, such as the Malaysian community, who are regulars at my parkrun, said a female aged 47. Now, both of these comments show that the importance of social inclusion and of people being integrated into their community. Now, the majority of the comments were very, very positive about parkrun, but there were a handful of negative comments. Most of the negative comments were relating to conflict between faster and slower runners or walkers at parkrun. And here is one example. I'm a parkrun passionista and have been dismayed to find that my home parkrun has adopted an aggressive move out of the way for faster runners attitude, one female aged 35. Now, parkrun is open to runners and walkers of all abilities, but in a small number of parkruns, there does seem to be some kind of conflict between the faster and slower participants. So the data analysis relating to mental wellbeing and parkrun has so far created more questions than it's answered. However, where I am at the moment is that I'm going to consider parkrun as a community-based initiative rather than simply a physical activity. This should help me to understand how parkrun may be having an impact on mental wellbeing. The Short Warwick Edinburgh Mental Wellbeing Scale data suggests that people from middle age and upwards are reporting different scores than the general population. From my background reading, I noted that men over 45 are particularly vulnerable to social isolation and poor mental wellbeing, particularly those who are living in deprived areas. Therefore, community-based activities are an appropriate intervention for that group, and they may have a benefit to be gained from parkrun participation. After I've analysed the comments that we've already discussed, I'm going to do in-depth interviews with men over 45 living in areas of deprivation, both those who attend parkrun and those who may live near a parkrun and do not attend. I'm hoping to identify the impact on mental wellbeing and the barriers to attendance, and then recommend ways to improve engagement with parkrun from this group. I'm hoping that the results may give ideas for a pilot project to improve engagement. An analysis of the pilot project will form the final phase of my PhD studies. So I'd like to say a huge thank you to my supervisors, Steve, Helen and Alice, who designed the Health and Wellbeing Survey and have supported me throughout my PhD journey so far. Thanks to all the parkrunners who took the time to complete the surveys. And thank you to my local parkrun ambassador, Porrick Fahey, who kindly allowed me to use some of his photographs in this presentation, including this one of my own parkrun in Galway. Thank you everyone for your interest, and I'd love to hear your comments and questions. Thanks very much.